Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to show you a case that fools you when you look at it. You would say she had all of her bicuspids out to be this caved in the front part of the mouth, but she is not at all. All of her teeth are there, and I'm going to run through this case. That she probably had her jaw kind of locked back there, may have some TMJ problem, but it wasn't a severe one. So let's get going, and I'm going to move real fast through this case just to show you what can happen, and a person can be that way with their teeth way back in. So let's get going on it, and I'll start here with this lady. Let's see if we, here she is. She worked in the office for my son, very efficient assistant and everything. And you look at her and you would swear up and down somebody had extracted her bicuspid teeth and look like they're more than that gone. And then when you look at her close, she's got a deep, deep bite. And when somebody's got a deep bite like that and they don't have any teeth out, anything, the teeth have to be extremely crowded on the lower arch like that. And so this is an odd case, but look at it through, and I'm going to go real fast through here. And we're going to open this bite. And when we open the bite, see, to start off with, right in here, the bite is almost in class 1 relation. This is correct here. Having the lower molar up in here like this, that's correct. And this is correct. That's correct. Pretty much that correct. Now when this is correct back here, and it's correct on the other side, if I remember. No, it's kind of slightly class 2 over on this side, but not very much. Now you would think those teeth have to be very, very crowded back there to fit in like that. So look at this top arch. When we started, it looks quite good right there. Now the lower arch is extremely crowded. That's what I told you here. But we're not going to take any teeth out on her. So we're going to open her bite using these intruding arches and things. You see this bar right here? It's carried down this way. We catch hold of those teeth and bring them down here. And you can do this type of orthodontics. Now the upper is pretty well lined up. So they're just lined up pretty much like we're going to keep them. But we had to lower teeth down. Now we don't lower one tooth or 2 or 3 teeth. We take the whole thing down, and the bone structure moves with the teeth. I don't care what they say, and the teeth and the bone and it'll move all a person's life. Now you watch these teeth go down as we go through this case. Now we open this, we put a little, as we got it going down, we put some spring pressure in here just to bring the teeth down, brought them forward like that. Watch this level out now. All right, now we've got them all the way down. Here's this intruding arch right here. This is a flexible arch, and we've got all those teeth lined up in here good. Here's the way it looked. Once I got them down like that, the midline is off. This was class 2. We'll bring this jaw forward and pull back over here to get this in the center. This is where we got a slight class 2 side over here on the left inside the mouth. Now this is lined up and it's in a rectangular arch. Now the bottom is lined up and it's in a rectangular arch too. And we've pulled this around in this direction like that to make room for this tooth here. We used a Facebook deal. I mean, this headgear fit across here. We're bringing her upper teeth forward. We tried to fill her facial structure out a little more, not pulling back on it, but push these pads fit over the cheeks right here, and you pivot off of the upper place here. It puts a lot of pressure on this to bring the teeth in a forward direction. But it was very difficult to bring her teeth out like that. So we brought it as far as we could. This band around the head, and then you can pull on these teeth without pushing this back. I didn't want to push back on the lower jaw, so it's not. So we pulled as much as we could, trying to get this to the front to some extent. We'd have to use a lip bumper and everything else to try to get it there. But we had very little success in actually bringing the teeth to the front. But we were able to level that lower arch, and this is the secret here. This goes way down, and it's pulling all this down. Now the bone, teeth, tissue, and all moves at one pace. In other words, you move the whole thing. You don't bury the teeth up in the bone when you do that. Now we made a bite plate for her, put it in her lower teeth with touch up here, and that helps bring the lower teeth down. Let's see. Is that the end of this case? No. All right, we got them down that far, and this was 12 of 91. And here it is later in 92. It held up like that. We brought those teeth down. That was, he was age 30 and 1 month. It was 90. And here we are in 93. We brought the teeth down, and she's still flat. And we tried to pull this out some, but it was very hard to do that, where we pivoted off of the cheekbones up here to do that with it. And here are the teeth after we level them out. You see we got this class as 1 here. This is almost, that's when we started the case. This was a little class 2 over there. And we've moved that forward. Now, this is a super class 1 now, and this is out to class 1 on that side, and that's 93. We checked her temporomandibular joints, and they look good. She had no problem. We freed her jaw up so she doesn't have any discomfort with that. Now, you can see, looking inside the mouth when we started, these were extremely crowded. And this part right here is, you see that other one locked in there. Now we opened the bite. It looked like that when we started. It looks like that when we finished, 93. Like that when we started. Now that's pretty much class 1 there. Now it is class 1. The midline is right dead center at that point. Now watch this. As we lowered this down, we brought this forward to some extent and this back, and we'll put that dot down in this point, go down in here. There it is after we finished. No, here it is. These two dots right over one another. Now, it is amazing what you can do with these arches. Now she wears a retainer to keep that from trying to go back at all. You have to keep it for several years. Maybe you sleep in it and she'll bite into that part up there and it won't go back. So finally, you see how the lower arch, one tooth is sticking out like that out at the bottom. And there like that. We put that bonded 3-3 on there to hold that in place and not let it move. So that finishes her up. She still looks like she's caved in the front. So this can be done on people. And this is the way orthodontics ought to be carried out. There's more adult orthodontics there than we could possibly do if you go in there. And with this crazy idea that adults bone doesn't move. It is so ridiculous that it is crazy. You look at somebody when they're 25 years old, then you look at someone when they're 65 and they're broadened out so much. The whole body, the bone moves all their lives. So we'll pass that on. Thank you for watching. I hope you get something from this case that you can use in your work. And that's one my reason for doing it. But this is a case that would fool you. You'd think she had teeth removed, but she does not. So I'm going to close out and say goodbye. I'm going to show you another one here in a little bit.